So we are very excited to be here and to be sharing some of our experiences over the last few years with research in corrections. So just to introduce our team, Dr. Stephanie Grace Prost is the primary investigator of the Older Adults in Kentucky State Prison Study, or the OAK study, and is an assistant professor here at the Kent School of Social Work. I'm not sure if she is able to join us today, but my name is Alex Neumann. I am a student in my final semester of the Masters of Social Work program and have been a research assistant on the OAK study for the past 3 years. And then I'm going to let Heather introduce herself quickly as well.
Hi, everyone. I just want to echo what Alex said. We're both very excited to be here and share some of our findings from this study. My name is Heather Oliver. I am in the first semester of my advanced year in the Master of Social Work program, so I haven't been an assistant on this study for very long. Most of my experience with the study has been how we've been able to translate the findings from it into the community since COVID-19 started. So I'm going to let Alex kind of take the lead, and we hope that you can take away some informative stuff from this. Thank you.
Thank you. So what we'll be going over today is, again, just kind of the origin of the OAK study project. We'll be talking about some of the initial findings from our pilot study. We were doing interviews in correctional institutions across the state for approximately 2 years prior to COVID. So we'll just be sharing some of those preliminary findings. We'll be definitely talking about how community engaged research and working with the Department of Corrections has kind of shaped our experience, and then also how COVID has kind of shifted that experience over the last year. So in terms of the project genesis, older adults are a large and growing population. With the aging of the baby boomer generation, coupled with legislation like the 3 strikes you're out policy, which increases sentence length for individuals with persistent felony offenses, we've seen an incredible expansion in the older adults in the correction system. Specifically here in Kentucky, the KYDOC experienced a 30% increase in the population of older adults just in a 4-year period between 2012 and 2016. As of 2019, 16% of incarcerated individuals were age 50 or older, and older adults actually constitute the largest age cohort in 7 of Kentucky's 11 correctional institutes. So in terms of the areas where there's a little bit of limited public awareness, health-related challenges for older adults are a huge barrier in these correctional institutions, and then as these individuals are trying to re-enter into the community. So post-incarceration options for older adults are pretty limited. They do require an increased level of care upon release, which means that there's a large and growing need for a continuum of care for persons with felony offenses, and then more narrowly for those individuals with sexual offenses. So this would include a need for supportive services through area agencies on aging, rehab and nursing care facilities, as well as hospice. And again, there's just very limited public awareness of these drivers, of the physical, mental, and behavioral health needs, which are anticipated to be elevated in these individuals because of their pre-incarceration and correctional setting characteristics. So justice-related experiences in the form of early childhood adversities, introduction to the child welfare system, and blurred lines between the victim and offender dichotomy. So thus, the Older Adults in Kentucky State Prison study was born with the aims of just generally better understanding the health, quality of life, and justice-related experiences of older adults, and then also the strengths and barriers of programming. If you could, thank you. So in terms of our initial findings from in these institutions, we were very lucky because we collaborated so heavily with the Department of Corrections. We were able to access a variety of institutions, including the State Reformatory, the Women's Correctional Institution, the Roeder Correctional Complex, Luther Luckett Correctional Complex, and the State Penitentiary. So across all of these institutions, we were able to sample just shy of 500 individuals. And what we found was that 74% of the older adults that we spoke with were likely to be returning to the community between their 75th and 85th birthdays. So this, again, just really kind of underscores the need for a better continuum of care to support these older adults in their reentry needs because they face such barriers, specifically the high average chronic health conditions, barriers around medication accessibility, and then the lack of accessibility to long-term care facilities. So in addition to like that reentry portion, the community portion, we also see that within these institutions, there are really elevated levels of mental health needs. So post-traumatic stress disorder particularly, we saw that 35% of responding older adults indicated a need for clinical intervention to reduce post-traumatic stress. And then that was across the whole study. Of the women that we sampled, we found that the entire sample met criteria for the provisional diagnosis of post-traumatic stress. This is, again, a clear indication of the mental health needs of these individuals. Carceral settings are considered to be a place of captivity with a lot of environmental stressors and just an increased need for a hypervigilance. So this, again, kind of supports what was mentioned previously, that these individuals have already experienced high adverse childhood experiences and pre-incarceration trauma, specifically victimization, and all of this coupled together can kind of lead to the potential for further traumatization, especially in these women. In terms of our depression findings, these were pretty dramatic too. 35% of the responding older adults indicated a need for clinical intervention to reduce post-traumatic or to reduce, and then further, 17% of the older adults in the sample actually met the clinical cut point for severe depression. So in terms of how the community engaged aspect has really kind of shaped our research, so the Kentucky Department of Corrections actually approached Dr. Prost about just the general needs and lack of awareness around this population. So they understand, again, the needs of these older adults and the fact that these needs are not necessarily being met like they need to be. They definitely have are really invested in the outcomes in terms of what we're able to, I guess, address in terms of programs within the institutions and then also in terms of reentry. So because of that, they have a lot of buy-in and have really kind of created that accessibility piece for us. In terms of some of the challenges that we have encountered, navigating the policies and processes of governing agencies in general can be really challenging. We found specifically that because this is such a vulnerable population with such unique health challenges and limited availability of quality health care, meeting the needs of these individuals in the institutions and then also within the community has been a huge challenge. And then now in the face of COVID, lack of accessibility to the facilities, both physically and virtually, and not being able to really do this work in the trenches has been a big challenge for us. And then again, just the reentry process of these older adults and the fact that the specific needs aren't necessarily being targeted has been another huge challenge. And then in terms of our values, individuals in the correction department don't necessarily hold the same values or code of ethics, or just generally the same strengths-based approach as we do as social workers. And so this is something that we just try to be very conscious of as we're going into these institutions and as we're sharing our work and our findings with the community. We really have tried to emphasize the importance of human relationships for these individuals, specifically now in a time where there's such a lack of visitation accessibility. And then also another big piece of the values is just the services and the fact that programming doesn't necessarily support the needs of these older adults, and that they aren't being targeted, as well as the social and emotional portion of their needs. So in terms of, again, how our work has kind of shifted since COVID-19, we were, again, in these institutions right up until our data collection was forced to end very abruptly in 2020. Since then, we have kind of shifted our focus to finding ways to synthesize data, identify and engage stakeholders, and then share findings and influence practice. Again, all of this has been done virtually. So some examples of what we have been working on in the past year include development of research-related praxis materials, both for the Kentucky Department of Corrections and the community. So far we have created some infographics around post-traumatic stress disorder, depression, and activities of daily living. Again, these were some of the areas that we pinpointed as affecting older adults most as they attempt to reenter, and just what is affecting them most in these institutions. We were able to integrate a lot of the Oak study findings and results alongside existing research, and we created some really brief, concrete strategies for practice in these institutions, which has been something that we're working on getting out there right now. Additionally, we have worked heavily in policymaker engagement this spring and the end of fall. So specifically, Senate Bill 26, this bill would exclude individuals with sexual offenses from stepping foot onto senior center grounds, which is particularly important because senior centers are kind of like hubs for older adults. So this is where these individuals can go to access different forms of assistance, from like rent and utility assistance to food. And then also this is a big area for like socialization and engagement for these older adults. So we're seeing that excluding these individuals from these senior centers would really affect their ability to access the resources that they are so desperately needing as they re-enter, and then also, again, would just really influence that socialization piece. In addition to that, we've done a lot with virtual community engagement. We've really engaged as much as we could with different coalitions and community groups around Louisville and across the state. And then specifically more recently, we have kind of shifted our efforts to share results with long-term care decision makers through a long-term care newsletter. We also have contributed a number of scholarly contributions. So since COVID, Dr. Prost has contributed to a call to arms and the gerontologist. She completed an interview with the Progressive on the graying of mass incarceration, and then most recently completed an interview with the Courier Journal on just generally the needs of this older adult population, and some of the barriers that they face as they re-enter. We have submitted a number of abstracts for correctional health, gerontological, and criminological conferences that are slotted for later on throughout the semester and the year. And then lastly, we have a couple manuscripts in progress, including the direct traumatic experiences and chronic health conditions among older adults incarcerated in prison, and then also gender disparities in health and well-being among older adults in prison. So just to kind of wrap up, again, despite the work, our work being kind of halted in the trenches this last year, we've been really lucky in being able to kind of shift that and focus on really engaging the community in any way that we can, spreading awareness, and again, just trying to get this information out to the movers and shakers and people who can make a difference.